Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to have a conversation with Professor Craig Coleman. He's joining us here as professor at the University of Connecticut to talk about some new data supporting XARELTO efficacy in people with AFib and sleep apnea. Welcome to Health Professional Radio, Professor Craig Coleman. Thank you for joining us.
Thank you for having me.
Well, I did, of course, say that you are a professor at the University of Connecticut. Give us a brief look into your professional background and talk about your interest.
Oh, absolutely. So I've been a professor at the University of Connecticut for over 20 years, and my area of expertise is in large data analysis and what we call health economics and outcomes research. My particular area of interest in terms of research falls under the area of what we call cardiometabolic disease. So anything that falls within that general scope is the type of work that I'm often involved in. In particular, an area of expertise, an area of great interest of mine is thrombosis and hemostasis, which brings us nicely into why we perform the study of atrial fibrillation in patients with obstructive sleep apnea.
Now, it's my understanding that this information was published in TH Open. It's a peer-reviewed vascular biology and medicine journal. What were the results of this analysis, this study that was recently published in TH Open?
Sure. So within that publication, again, what you mentioned was published in Thrombosis and Hemostasis Open. The idea is to evaluate the effectiveness and safety of rivaroxaban compared to warfarin, so two anticoagulants, in patients with nonvalvular atrial fibrillation patients who also had concomitant obstructive sleep apnea. And the reason we do this is that obstructive sleep apnea and atrial fibrillation frequently coexist. Data suggests that anywhere from 21 to 74% of patients with atrial fibrillation may have concomitant obstructive sleep apnea. And obstructive sleep apnea has been shown to not only increase a patient's risk of AF, but also a lot of the comorbidities like hypertension, diabetes, heart failure, vascular disease, and stroke that are risk factors for blood clots or thrombosis in patients with atrial fibrillation. So it really made sense, again, to assess the effectiveness and safety of rivaroxaban versus warfarin in patients with atrial fibrillation who also had concomitant obstructive sleep apnea. And so what we did was an analysis of electronic health records data to evaluate adult patients who had both atrial fibrillation and obstructive sleep apnea at baseline and who were newly initiated on rivaroxaban or warfarin. And the study ended up, again, we used a large electronic health records data set. We identified nearly 22,000 rivaroxaban patients and over 38,000 warfarin patients, and found that rivaroxaban had a similar effect or a similar risk of developing stroke or systemic embolism compared to warfarin. We're looking at all the patients in the analysis. However, when we restricted the analysis to only patients to which current clinical guidelines recommend anticoagulation treatment be used, and this is in patients who have elevated CHADS VAS score, so a CHADS VAS score greater than or equal to 2 for men or greater than equal to 3 for women, rivaroxaban was actually found to be associated with a significant 33% reduction in your risk of having a stroke or systemic embolism. Of course, when we're talking about anticoagulation, we always have to be concerned about the risk of bleeding, since this is a common side effect of all anticoagulants. And what was demonstrated, in fact, is rivaroxaban was associated with a 15% reduced rate of bleeding-related hospitalizations as compared to warfarin, including a 14% reduction in intracranial hemorrhage, the bleed types most associated with a high degree of morbidity and mortality.
Now, have you mentioned the process? That's quite a few patients. I heard 30,000 and then another figure that's a little bit over, somewhere around 60,000 patients. Did you describe the process that was followed for the data collection among that many participants?
In this data set we're doing what's called an analysis of an electronic health records data set. So this is pre-existing data that insurers keep for the purposes of assuring proper payment and reimbursement. but is often used, quite frequently used by researchers such as myself to perform clinical studies. And so we use data from November of 2010 all the way through December of 2021, which allows us to identify a very large cohort of patients. If we tried to do this, for example, as a randomized control trial, and recruited patients prospectively, it would probably take us a decade to recruit enough patients in order to do the analysis. So in this case, we're doing a retrospective analysis. We're going back in time, looking at patients by assessing their electronic health records, and then making these comparisons between rivaroxaban and warfarin.
When it comes to the significance of the study, the findings, what's the bottom line, Professor?
Well, I think the biggest goal of this study was to demonstrate to providers that they should have additional confidence in selecting an oral anticoagulant, particularly in this case rivaroxaban, in atrial fibrillation patients who also have obstructive sleep apnea at the time of anticoagulation initiation. Again, these disease states occur so frequently together that it's important that we assess the efficacy or the effectiveness and safety of a drug like rivaroxaban in this very specific patient population. And in fact, I believe, at least at the time of writing and publishing of the study, that it was the first article to actually assess the use of one of these newer oral anticoagulants, or what we call direct-acting oral anticoagulants, in this case rivaroxaban, compared to warfarin, that's ever been published in the literature. So again, this is a first, and it's quite a large study that provided us with quite a bit of a power and ability to assess this research question adequately.
How would this newfound power benefit patients effectively with NVAF as far as clinicians using this data?
So right now, clinicians are already probably predominantly using drugs like rivaroxaban, these direct-acting oral anticoagulants. However, there still is a fairly substantial proportion of patients who are receiving warfarin, which is a 50-year-old drug, which is honestly akin to, in many ways, pharmacologically to rat poison. And, you know, at this point, despite the fact that guidelines recommend that we use these DOAC agents like rivaroxaban, patients are not necessarily getting it. They're still getting warfarin, or in some cases getting substandard therapies such as aspirin or no anticoagulation at all. So any type of evidence that we can provide healthcare providers and that we can provide patients to support the proper use of these direct-acting oral anticoagulants is going to be beneficial to both prescribers, to patients, and ultimately to society as a whole, because ultimately my goal as a researcher is to make sure that patients are getting treated in the best possible way, and providing evidence to clinicians to assure that they're prescribing their medications in an optimal fashion.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more?
Most important thing to point out here is, again, this is an observational study. An observational research should not automatically supplant what we call randomized controlled trials, which are the gold standard for proving the efficacy and safety of the medication. However, again, what these results do really is reaffirm a lot of the results that we saw in some of the major clinical trials, such as the trial called ROCKET-AF, which looked at rivaroxaban versus warfarin in patients who had atrial fibrillation, not necessarily all these patients having obstructive sleep apnea. Some of them certainly did, but the preponderance of patients probably not. But our results really demonstrate that within a AF population who also has obstructive sleep apnea, that our results were very consistent with the overall clinical trial of ROCKET-AF, and that's very reassuring. If clinicians are interested in learning more about the study, which was titled The Effectiveness and Safety of Rivaroxaban versus Warfarin Among Non-Valvular Atrial Fibrillation Patients with Concomitant Obstructive Sleep Apnea, they can access the journal online at the Thrombosis and Hemostasis Open website, and they can't, because it isn't, can access the article for free.
Well, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio. Professor Craig Coleman, thank you.
Thank you very much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Professor Craig Coleman. Audio copies of this program are available at hpr.fm, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.